The average heart pumps 2.4 ounces per heartbeat. On average, the heart beats 72 times a minute. That means the average heart pumps 1.3 gallons a minute, 1,944 gallons a day, and 709,560 gallons a year, guesstimating. But for the heart that suffers from cardiomyopathy, a condition in which the heart becomes weakened and enlarged, the heart cannot pump as efficiently, and that heart might not be pumping out anything close to what the average heart should be pumping.
When the heart squeezes, it's not kicking out every ounce of fluid and not every ounce of blood. So let's say a heart's relaxed and has about 100 ounces in it. When the heart squeezes, it goes down to about 50, maybe 45 ounces left from 100. And then we do a simple mathematical formula, 100 ounces minus 50 ounces, and that is ejecting 50% of the fluid or blood in the heart. That's called ejection fraction. And so anything that's 50% or more, ejecting more than half the blood, is considered normal. So the word cardiomyopathy is referring to this thing called ejection fraction, the strength of the heart muscle. So we're not so much directly talking about thick or thin, which does play a role. We're most importantly talking about strength. Is it kicking out half of the blood or more every time it beats? So 50% or more is pretty much normal for us. Mild weakness might be in the 40 to 50 range, and moderate might be in the 30 to 40 range. And severe weakness is usually below 30% or less in terms of what percentage of fluid or blood is ejected out of the heart every time it beats.
High blood pressure is the most common cause of cardiomyopathy, but anything that causes weakness in the heart muscle can be a cause as well. Atherosclerosis, diabetes, and high cholesterol are risk factors, especially if they lead to a heart attack, which can cause significant weakness. Viral infections and immune disorders that attack the heart are also causes, though in very rare cases.
So it's a grab bag of different causes leading to the same basic problem, which is weakness in the heart muscle. And weakness in the heart muscle, and besides making you just feel tired or short of breath, can eventually cause water to back up into the lungs, and that's where the word heart failure comes in. You may see the doctor because you're feeling short of breath, because you're waking up middle of the night short of breath because water is building up in your lungs. You may see swelling in the ankles. Now, not to alarm anybody, most swelling in the ankles is from varicose veins, but occasionally, combined with shortness of breath, it can be a sign of cardiomyopathy or water building up.
Diagnosing cardiomyopathy starts with listening for heart murmurs or signs of water in the lungs or legs. If there's any suspicion, the patient will undergo an echocardiogram, which is an ultrasound of the heart. This sonogram reveals the strength, size, and thickness of the heart. If cardiomyopathy is diagnosed, treatment must begin because it can be dangerous if left alone.
The risk is not just water building up. The risk includes irregular heartbeats, which can be life-threatening. And so many of you have heard of pacemakers and defibrillators. These little metal devices get implanted under your skin. They actually can monitor the heart rhythm. And for people where the strength is under 35%, we know there's more of a risk of dangerous irregular heartbeats and that they might qualify to get these preventative implantable defibrillators to prolong life and treat any dangerous irregular heartbeats that may occur. And cardiologists called electrophysiologists put in these devices called defibrillators that help treat the worst of the cardiomyopathies. The in-between group, between 35 and 50, we usually can treat with any of the modern medications we have nowadays. Medicines that can help the heart beat more efficiently. Medicines that can help the heart relax a little better so that it's healthier in the long run. Some of these medicines called beta blocker medicines that we treat for blood pressure help the heart relax and eventually reverse some of the weakness in the heart muscle. So the modern medicines that are part of our armamentarium not only can help stabilize weakness in the heart, but occasionally, if we're lucky, can reverse that weakness to some extent and help improve a cardiomyopathy.
For most, cardiomyopathy just needs to be monitored and treated by a cardiologist. You can help prevent cardiomyopathy by controlling high blood pressure with a healthy diet and exercise, consuming enough vitamins and minerals, and avoiding excessive alcohol and consumption of drugs. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.